The Ministry of Health has recently labeled the uptick in new COVID-19 infections and fatalities in Guyana as a new COVID-19 surge, which is targeting younger people who are becoming severely ill. According to advisor to the Minister of Health, Dr. Leslie Ramsamy, while this is not the first time the virus is attacking the younger, healthier population, it is now making them ill at a rapid pace. Those with no known underlying medical conditions are not excluded from the new and disturbing reality. However, while most of the COVID-19 vaccines on the global market were created to protect persons from the initial SARS-CoV-2 virus detected in Wuhan, China in late December 2019, the virus has witnessed several mutations since then. Minister of Health Dr. Frank Anthony, during Wednesday's COVID-19 update, said while health authorities are unable to confirm whether or not the new Brazilian P1 strain has surfaced in Guyana, they have observed a trend of more persons being hospitalized because of difficulties in breathing. The country's healthcare system does not allow for the detection of any of the COVID-19 variants. As such, arrangements were made with the Caribbean Public Health Agency in Trinidad and Tobago and the Icahn School of Medicine in New York for local patient samples to be sent for testing. Since January, no new samples were sent to CARFA by the Ministry of Health. Dr. Anthony, when asked by this newscast whether steps are being taken to expedite the process to have additional samples sent for testing, informed that the ministry is still pursuing that arrangement.
We have collected a set of samples that we like to send, but we have to make those arrangements. We haven't concluded making those arrangements as yet, but we are working on that.
He was also questioned on whether or not any of the 3 vaccines currently being used in the ongoing vaccination exercise would safeguard recipients from being infected with any of the new variants. While evading a definitive answer to the question, the minister maintained that vaccines prevent the worst form of the disease.
What I will say is that with vaccines actually would help to prevent persons from getting the most severe form of the disease, which is very important. So while the vaccine would not give you 100% protection against infection, because with all the vaccines that are currently on the market, there's still a chance that you can get infected. But if you get infected, you will get a milder form of the disease. So despite whatever variant it is, these vaccines still offer protection against the most severe form of the disease.
To date, data has emerged from a UK phase clinical trial that suggests that the AstraZeneca Oxford COVID-19 vaccine has some level of efficacy against the South African B117 variant. South African health authorities have since indicated that 2 doses of the AstraZeneca COVID-19 vaccine were found to have only a 10.4% efficacy against the variant. Guyana has recorded 16 COVID-19 related deaths in the last 7 days. March is considered the deadliest month for the year so far, having tallied 36 deaths. Active cases at the moment have surpassed 1,000. On Tuesday, neighboring Brazil registered more than 4,000 COVID-19 related deaths in 24 hours for the first time. A more contagious variant, P2, is said to be the cause of the surge. Temika Rodney reporting for the HGP Nightly News.